Hello, I'm Kelly Jansen. If you have watched the news, you are probably well aware of this worldwide epidemic known as Ebola. The World Wide Health Organization also refers to it as the Ebola virus disease, EVD. I'm essentially here to put Americans at ease due to this disease. Uh, that way they don't panic because it's not as big of a concern in America. I'm also going to discuss what Ebola is, where it originated from, how serious Ebola is, and what we are doing to prevent Ebola from spreading all over the world. I've gathered some factual information, and I'm going to start out with my first source from the Mayo Health Clinic. This site states what the disease is, some symptoms, causes, and treatments that we can, United States, can provide to prevent this disease from spreading. The disease is a virus and illness caused by severe bleeding, and it essentially shuts down your organs and could possibly cause death. It lives in animal host and it spreads from person to person through contact, through bodily fluids, or contaminated needles. So it is not an airborne disease. So if you're sitting next to a Western African person, that doesn't mean you have the disease. So do not panic. If you do not share bodily fluids, there's probably a good chance you do not have the disease. And that's why I'm here, because many people just panic and think, oh, I have Ebola and whatnot, so I'm going to uh, change that and prevent that from happening. So some symptoms. I found some symptoms on the Mayo Clinic, but I also found a source entitled "Ebola Outbreak: 5 Things You Need to Know." And on this site, it states most of the symptoms from day 5 to 9, when you're first initially exposed to the disease, it's normally common cold or flu symptoms, such as headaches, fatigue, fever, and chills. And then later on, as you have the disease after that day 9, from day 10, 11, 12, it progressively gets worse from there. Uh, and what I mean by getting worse, it normally causes chest pain, stomach pain, severe weight loss, and bleeding. Bleeding is the most identifiable cause of Ebola, just because it's a lot different. The bleeding that it causes, it can cause bleeding from your eyes, nose, mouth, ears, and even anus. So if you have that symptom, it's probably a good measure that you probably have Ebola. Okay? So, which leads me into my next topic. You probably want to know where Ebola originated from. This leads to my next source. I found Center for Disease Control and Prevention, also known as CDC. Uh, it talks about the 24 Ebola outbreak in West Africa. If you look closely, like right there, it shows where the disease originated from, which is West Africa. Uh, Worldwide Health Organization also states it pretty much comes anywhere along the Ebola River, and that's where it's got its name from. Many of the main sources, countries that it came from, the third world countries, is from Sudan, Republic of Congo, Guinea, Liberia, and Nigeria. There's also been a case that was cited from the Mayo Clinic that in 1976, the Philippines also had a case that came from pigs. This disease comes from typically in this 2014 outbreak. It has been known to come from monkeys, chimps, primates, and your typical different types of bats. Mainly the common bat, the fruit bat. So that's how it's spread, is through those animals. All right. So let's get to the point of how serious Ebola really is. If you're in a third world country, I would be a lot more concerned. But we are from United States. We're United States citizens, and we have great hospitality, hospitals, well-trained nurses and doctors, and we've had we've had great, wonderful types of training. And recently, our training our facility members on this case, just in case it does spread in the United States. There has been 1 or 2 cases, And again, I gathered all my facts from October 5th, so there may be some other sources or other known cases in the United States from then. So this is 3 days old, but as of right now, there's only been two sources. So there's also the reason that makes this disease so deadly is because there's no known vaccinations right now, and so you know how serious Ebola really is. But with America, one thing that we do for treatment is stated from the Mayo Clinic. Some things that we do is we provide fluids. If you lose fluids, give those individuals IVs, and then if they lose blood, obviously you want to replace that blood. So we have that. We have a lot of blood and whatnot, and we can provide that many third world countries may not. And you also want to make sure that you maintain their blood pressure, make sure they're comfortable, and you want to treat their infections. So coming from an animal, there's probably could be essentially a lot of infections, and especially coming from internal and from internal organs. So, some other things that we're doing is the Center for Disease Control and Prevention. Some things that they're doing is they're assisting with response efforts in Western Africa. They are also trying to discover those two vaccinations that I talked about, and they're also studying patients in laboratories and collecting laboratory testing from the individuals that were tested. The Worldwide Health Organization, correction, I just discussed that. The Emergency Operations Center, they're providing technical assistance as well in those areas and trying to get those third world countries knowledgeable with the disease and try and prevent this disease from spreading. So again, one thing I want to harp on is don't panic when you have these symptoms. The main symptom to identify is the internal bleeding. Once you have that disease, you probably want to go seek proper care and go to a hospital, because then you have a good chance that you maybe were affected by the disease, especially if you were in Western Africa or a third world country, or were in contact with somebody from West Africa. Okay, so now that you know what Ebola is, should put you at ease, and we can rest assured that that we are well taken care of. All right, thank you for your time.